I'm here with Dr. Michelle Graham, a cardiologist at the Mazikowski Heart Institute, to talk about Alberta Health Services' campaign to encourage Albertans to seek medical attention if needed. Thank you for joining us today.
My pleasure.
So, this latest message actually follows up AHS's Listen to Their Bodies campaign. Why the recent push to get Albertans to see their doctors?
I think it's important to remember in the setting of the pandemic that there's more to your health than just trying to make sure that you don't get COVID-19. And we've been getting a feeling that people are neglecting their health and other severe health concerns due to concerns that they're overwhelming the healthcare system, that they might catch COVID, all sorts of different things. And we have the advantage of having COVID start a little bit later in Alberta than it did in Europe. And we have seen what happened in Europe, for example, in Italy, significant reductions in patients coming in with heart attacks. Other places have reported the same thing with strokes, and we started noticing the same thing here. Similarly, the cancer group noticed a decrease in people presenting with cancer type symptoms. And it doesn't mean they don't have cancer, it just means they haven't come to light yet. So I think now is a good time to remind everybody that health is more than avoiding COVID-19.
Absolutely. And how can that hospital visit help in the long run?
So remember, I'm a cardiologist, so I think about acute conditions. So if you have what we call an acute time-dependent condition, such as symptoms of a heart attack or symptoms of a stroke, the faster you get medical attention, the faster you get therapy, the more effective the therapy is, and the more likely you are to end up without a major problem in the end. So for example, if a patient comes in with heart attack symptoms and they come early enough, we know that after receiving very timely treatment, that a proportion of those people will end up with minimal or even no heart damage as a result of a heart attack. That's what we want to provide to people, that kind of care. But if you delay in coming into the hospital, those chances are markedly decreased, and you're more likely to end up with significant heart damage and the complications that follow with significant heart damage.
You did touch on this already, that some people are choosing to stay away from hospitals during this pandemic in fear that they may catch COVID-19, as well as potentially other reasons for why they're choosing not to go. What would you say in response to that?
I would say that healthcare providers and hospitals are doing their absolute level best to make sure that this is as safe an environment as possible. It is safe to come to the emergency department to seek emergency medical attention. It is much safer than staying at home. Our units are safe. We are all well versed in PPE, and we are doing our very best to keep everybody safe. And fortunately, you'll notice that our COVID numbers are down because everybody is paying attention to those very important healthcare measures that we have to keep in place. But there are times where you have to not stay at home. There are times where you have to come to the emergency department.
And do you have a note at all that you'd like to end off with?
I would just like to remind everybody that, health is more than COVID-19. COVID-19 is very important, but you can't forget the rest of you. And if you are having chest pain, if you are having symptoms of stroke, if you have a lump that needs to be looked at, we are here for you. Please come and see us.
Perfect. Well, thank you for taking the time to speak with us, Dr. Graham. I appreciate it.
You're very welcome. Thanks for having me.